Hi, my name is Dr. Michael R. Sardone, and I practice functional and nutritional medicine. My practice is located in Del Mar, California. What is functional medicine? Functional medicine is a science-based system of personalized medicine that focuses on the root causes of chronic illness and the correction of these underlying dysfunctions rather than treating just symptoms. I like to use the analogy of the iceberg. We look at an iceberg, we see the tip, which is seen above the waterline, but we all understand and appreciate that it's the base that is hidden and is the most dangerous. And it's this base that is a combination of genetics, environmental inputs, and lifestyle behaviors that are underlying factors that contribute to chronic symptoms and illness, predisposing us to symptoms that are chronic. And if we look at some of these symptoms, and these are just a few, we see weight gain, constipation, heartburn, bloating, memory loss, brain fog, depression, high blood pressure, increased blood sugar, headaches, systemic inflammation, fatigue, weakness, swelling, confusion, anxiety, all attributed to the underlying factors. And some of the diseases that can manifest over time and become chronic are autoimmune diseases like rheumatoid arthritis and Hashimoto's disease of the thyroid, kidney and bladder disease, liver disease, gallbladder, insulin resistance and diabetes, heart disease and lung disease, mental illness, cancers, stroke, thyroid disease. Again, manifesting from dysfunctions of the base of the iceberg. There are different approaches on how to manage these conditions. Conventional medicine typically treats based on acute care, and they will treat chronic conditions using the same acute model by prescribing medications for symptoms. So for every symptom, there is a drug. Unfortunately, this acute care philosophy doesn't work well with chronic conditions, and that's where functional medicine doctors come into play. We focus on the underlying factors or the root causes of illness by looking at how genetics and environmental inputs and poor lifestyle can predispose individuals to these symptoms and chronic illness. Now, acute care has a place for infection and broken bones, but it doesn't work well with chronic conditions. Some of the core imbalances and dysfunctions that will occur based on these underlying factors or disruptions in the immune system secondary to environmental inputs or genetic predispositions or poor lifestyles. Some of these imbalances will affect the gastrointestinal system, the gut, where 70% of the immune system is developed. And we look at oxidation and free radical damage that occurs, damage to the mitochondria and the cells, predisposing one to degeneration and disease. The detoxification and immune imbalances. We have a phenomenal detoxification system built in. Liver, kidneys, lungs, skin, and the gut will help detoxify toxins that enter our system every day, either from air or from the foods we eat or what we swallow, and things that we're exposed to in our environment. And if our detoxification system is not functioning properly, this can cause problems with our immune system, which will predispose us to disease. Micronutrient imbalances and deficiencies in vitamins and antioxidants and phytonutrients and minerals will cause imbalances and dysfunction, predisposing us again to immune suppression and disease. Chronic systemic inflammation affecting the whole system can be a precursor to heart disease, cancers, diabetes. Hormonal and neurotransmitter imbalances, imbalances in sex hormones like estrogen, progesterone, testosterone, neurotransmitters like serotonin can affect our mood, our appetite, our sleep patterns. Then we have structural and functional imbalances. Problems with the structure of the spine, the joints can predispose to degeneration and arthritic changes and problems with the neurological system. So it's the combination of all these core imbalances and dysfunctions that predispose us to symptoms and then chronic disease. Now, my approach to evaluating patients is looking at the medical and nutritional history, then doing a thorough physical exam, incorporating musculoskeletal and structural assessment, body composition assessment, body fat, lean body mass, etc., cardiovascular and fitness assessment, then ordering specific diagnostic lab tests, and based on all these findings, putting together a customized wellness program to correct the underlying dysfunctions. Diagnostic lab tests that are available are urine analysis, a number of different blood chemistry panels and profiles, micronutrient testing, looking again specifically at any deficiencies, vitamin, mineral, antioxidant, phytonutrient, actually looking at the lymphocytes, the white blood cells, and seeing exactly what those cells are deficient in. Hormonal testing, using saliva, blood, and urine, looking at various hormones from estrogen, progesterone, cortisol, DHEA, testosterone, etc. Stool analysis, looking at digestion and bacterial balance and any signs of inflammation. Toxin and heavy metal screening, looking at heavy metals that may have been accumulated over time. Allergies and food sensitivities to gluten, soy, dairy. Oxidative stress, looking at damage at DNA and mitochondria, how it can affect our energy, and how it can predispose us to immune suppression and disease. And then finally, looking at bone loss markers. We can detect this early in the urine, even before it shows up on X-ray. Using nutritional medicine as a treatment protocol, it's like functional medicine in the sense that it's a preventative measure, looking at natural methods of treating chronic conditions through personalized and specialized dietary and nutraceutical protocols, specific diet for specific needs, including nutrition and supplementation. Wellness programs are designed based on patient history, examination, and laboratory test findings. A customized wellness program is prescribed, designed to correct the underlying dysfunction, and using dietary and nutraceutical and supplement protocols. Wellness program is essentially your foundation that other treatments can be added to or built upon. And that's important to understand. Unless your foundation is correct, it's going to be very difficult to resolve your symptoms or your condition. And we can add to this foundation the detoxification programs, or utilizing physical medicine, chiropractic care, acupuncture, exercise programs, cross-training, aerobic, weight training, stress management, and other ways of treating, and even referral if necessary for other medical specialties if there's a specific need. But wellness programs are designed specifically based on the whole patient rather than on the patient's symptoms. You know, Thomas Edison was once credited as saying that the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in proper diet, and in the cause and prevention of disease. And I can't think of more poignant words to be spoken or written that best describes my practice and the essence of treating a patient. Prevention is the key. You know, I was told that prevention is much easier than treating the disease itself, and I have found that to be very true. Unfortunately, many patients don't seek help if there's no need, in the sense of not feeling ill. But evaluating the patient using the functional medicine model can give us a lot of information that can help us prevent disease by correcting any underlying dysfunctions. Thank you for visiting my website. Feel free to peruse through, click on other parts of the site to get more information. Thank you very much.